Go.
Novelty sound bites. Oh shit.
Anonymous podcast.
Yeah, I smoked a lot.
All right. So you work where?
Black hospital.
And what do you do there?
I screen patients. I go to their bedside and I screen them for insurance. So I see if they're eligible for Medicaid, for charity care, and that's what I do there.
So right now, during the coronavirus, somewhere around getting close to the peak, to the height of the coronavirus, what's that experience like?
What it's like, it's terrible. Seeing that every single day, walking around, seeing it escalate, seeing all of your, not all, but seeing a lot of your coworkers get sick, you know, half of the staff out, seeing the dead bodies being rolled out every day, talking to them on the phone. And that's why
What's that like, talking to them on the phone? What do you have to talk to them about?
you have to do a screening. So you have to screen them and pretty much see what they're eligible for. Are they single? Are they married? Where do they live? What county? If they have cancer, if they have some type of illness that's going to cause them to be disabled for the next 12 months, because that'll change what they qualify for.
You want to drink?
Yes, please.
So what's the worst thing that you feel like you've discussed with someone over the phone? Like what's the worst, maybe the best and worst reactions that you got from people talking to them?
The best is when I speak to them and they're doing fine. They're stable. We're coming up with a discharge plan for them, and they're recovering, and they're gonna go home. And back, after 2 weeks, they're gonna see their children, their wives, their moms, their dads after
Just
2 weeks.
seeing them, they know it's going to be all right.
Yeah,
So what's the worst?
when they die, when you speak to them,
You have
and
to
then
tell them that their loved one passed on. Like, what do you say to them? Like, what do you?
well, no, when I call, let's say someone right now, I have a 16-year-old, healthy, whatnot, because they claim only old people are dying. No, that's not what I'm seeing. I see every single patient that's admitted every day, what their diagnosis is, this and that, the different ages, from 3-week-old babies to 7-year-olds to 16-year-olds, healthy jock on a ventilator. There's no visitors allowed in the hospital at all. Their parents can't go see them. Their wives, no one. The hospital is bombarded.
So what happens when a person passes on? What do they do with the body? What does their family do? Do they?
Well, what I see every day, and they pass them right in front of the office where I work, and I see them. There's big coolers outside, and they put them right in there, straight to the morgue. There's no funeral, there's no service. That's it. They're pretty much vented, they pass. The family never sees them again. The body's burned, and that's it. There's no closure, no nothing.
So what do you think about that? Like, what do you like? How do you? Like, do you cry? Do you feel anything? Do you have emotion about it? Do you feel like it's just a job and you go home?
I don't know. I wish I could cry. There's 3 of us that we work together. Well, there was 3 because one now she's at home with the virus. She's okay though. She pretty much has what looks like a sinus infection, and that's pretty much what she's feeling, and body aches, but she's fine. Her boyfriend has it, his parents have it, and everyone pretty much has flu-like symptoms, but they're okay. But the other girl, she just cries constantly. And I can't cry. I wish I could cry, but I
Kind of
just,
numb, like you just
I
get numb
am.
to it.
I am.
Do you think that's just you, or do you think anybody in your position would?
No, it's just me. It's just me. Because everyone else has broke. Everyone else
Let me
has
ask you this
quit.
question: do you drink on the job? Do you smoke on the job?
No, nope. not at all. Not at all. And I bought a big case of liquor, 5 big things, thinking, that's it. The world's going to end. Let me go run to the liquor store. And I haven't even drank. I'm just working 6
Did
days
you
a
buy
week.
toilet paper?
I sure did.
Why? Why is everybody buying toilet paper?
I
What's the
don't
big
know
deal about
why
toilet paper?
people are just being greedy and just
For toilet
racking
like-
up for everything.
Like toilet paper
You
greedy?
can't find Lysol, you can't find Bounty, you can't find a lot of different things. So people are just being greedy, not me. I rack up and I share with my friends. Didn't I come bearing Lysol?
Yeah, thank you. Mm-hmm. Yeah.
Yeah.
So, all of the people, what hospital is, all of the people at the hospital, are they now just coronavirus victims? Or
No.
are there,
No.
so is there some ward that they go to, or?
We no longer even have a cafeteria. We're getting slammed and slammed and slammed. Luckily, our hospital has been able to build rooms and rooms and rooms in the hallways, and they are able to accommodate these patients, but it's just growing and growing and growing. And the problem is that a lot of people are going to the actual hospital and they shouldn't. If you have fever, you stay home. There is no cure. It's like a flu. You take 2 Tylenols, not Aleve, not Advil, Tylenol for some reason. You stay home. The only reason why you should go to the hospital is if you have difficulty breathing, then you go to the hospital. But people are freaking out. They're like, oh my God, I have a sore throat, I have this, and that's why there's like no space, So that's why.
So, what do you ever talk to the doctors about what it is? What do they say?
They're just frustrated.
Why?
They're frustrated because there's no supplies. There's not enough staff. Their staff is getting sick. Their staff has the virus. They're short staffed. There's no mask, Luckily, Hackensack, they've gotten a lot of donations lately, and they've been really good with prepping. So, but it keeps on growing. The numbers are growing and growing and growing. So
that's what makes the doctors frustrated about it?
yeah, definitely. And
so
on
there's
top
no
of
medicine that you can really give
that,
somebody?
nope, there is nothing. There's no medicine. You just have to pretty much stay home. It's kind of like a flu. And if you're one of the lucky ones, like most, I don't know, there's like, I'll give you an example. One of my coworkers, she's married. She has it. Her husband has it. The baby, we don't know. We're waiting on his results, and her parents have it. She has no symptoms at all whatsoever. Her husband, he had a runny nose. That was it. No cough, no nothing. But then her parents had fever, body aches, really, really bad. But her mom was really, really severe. So it just really depends how
So
it
let me
runs
ask
through
you
you.
this. So let me ask you this question. Why don't they just give it to everyone? This is just a theory that someone else, I think the Republicans came up with this, whatever. Why don't they just give it to everyone so that everyone just gets it and then becomes immune to it?
Because people are dying from it.
But people are gonna die from it. Like, we're all gonna
So
get it.
why
Like,
would we? But we've probably had it because it didn't just come out recently. They claim that this has been out since November of last year.
well, all right. So technically, it says coronavirus on every cleanser and Lysol can since like forever.
Of
like
that
it's
strain.
always been a coronavirus.
Yeah, it's
So
yes.
so this one is like a different strain.
This is like the remix. This is like the 4.0 different strain. This is some different type of stuff.
So now, so basically, all right. So other side to the coin. For the people that they get it, then they develop some immunity to it, like
Well,
some
we don't know.
antibodies or something.
We don't know
Well,
that
I was
yet.
watching on the news today. I don't work in the hospital, obviously, but
Mm-hmm.
I was watching on the news today, and they said someone had it. He recovered from it. He donated his plasma.
Mm-hmm.
Do you know what that does? When they donate the plasma, what does that do?
I heard that they are kinds of just taking that and kinds of they break it down, they separate everything, and they see if this person is immune to it. That way they could take it and I don't know, mix it with whatever other medicine and something to see if it could cure other people. So they are playing around with that. I did hear that, but exactly what that does, I don't know. But there is no cure right now. There is no cure.
So when people go into the hospital,
Mm-hmm.
it's only for the ventilator.
No, everyone's going to the hospital. Everyone's like
But realistically, they should really only be going for the
if
ventilator.
they have breathing problems, yeah.
That's the big deal. Other than that, they
Yes.
might as well stay home.
They need to stay home because they are
Even if they
taking
have
up
it.
space. Yeah, if they have it. So many of my coworkers have it. They're home right now. They're okay. Some
Are
you
they
know.
getting paid for being home?
It really depends because some of my coworkers work for the actual hospital. So if they have been directly exposed, they are paying them while they are home. They're
Oh, so let me ask you this question.
but
So
other
they're paying
vendors
them-
no.
They're paying them if they were directly exposed. So you go to a job, they work at the hospital, they work,
Mm-hmm.
they got exposed, and they know that 90 whatever the biggest percentile is, they got the coronavirus from showing up at work. Is the hospital or someone now liable?
No. No, because they're showing up at work. It's not the hospital's fault. You're just working there. The shit is going around. If you catch
So
it,
there's
well,
no one that they can go to, a
Nope.
lawyer,
nope.
and say, I got this from.
There's no laws. There's no rules to this. This is something brand new. This is something that's just happening, and they're winging it.
But are you
Day by
sure
day.
though? Maybe someone didn't actually investigate and find out if there's.
No.
Because everyone gets
They
disability,
called-
so they wouldn't get disability.
Okay, right now, I have some coworkers that they work directly for the hospital. They're getting paid to stay home. If you work for a vendor of the hospital, it's, it really varies.
So what's
it
a
changes.
vendor? What is a vendor for the hospital? What
A
does that
vendor
mean?
that you work for, like, let's say a company, let's say like a billing company, and you're stationed at the actual hospital, but you don't work directly for that hospital. You're just stationed there, but your
Like-
check comes from another company.
Like when you, so sometimes I go to the grocery store, but the people that work in the grocery store don't actually work at the grocery store, but they're stocking the shelves. That's a vendor. To me, they're like the little green men. Like, you know what I'm talking about? They're like people that come out of nowhere. I don't work for this place, but I'm working at this place.
Yeah.
So they have vendors.
Yeah, so then
So what's
it
the-
depends.
What's the
Some people are not. And this is what we found. A lot of people are hiding their symptoms because they know, holy shit, hold on. If I test positive and my boss finds out, I'm going to go home and I'm going to have to stay home for 2 weeks. And then after that, I have to use all of my PTO. So people are being sneaky and they're like, no, I feel good. And they're just showing up at work with symptoms, but they're worried about being fired, about losing, their like personal vacation time. So it's really crazy. It's really
what's
crazy.
the saddest thing you've experienced out of this?
Seeing the line of dead bodies just being rolled out and rolled out and rolled out. And then talking to the people, and they're just, because we have to call the mom, the spouse, the cousins, the this and that, just trying to screen them, the next of kin, if the patient is sick or if they're like vented. So we have to reach out, and when they just hear us and I'm like, hi, I'm calling from Hackensack, they just They just break down crying. They're like, how are they? We're trying to get through. No one's giving us any info. And that's what I keep on hearing. That they're calling and no one's telling them how this patient is. There's no visitors allowed. So imagine your son is there, your mom, your dad, they're vented. You have no idea what's going on. There's no visitors allowed in the hospital. So they're just waiting for that phone call. So whenever they see that area code, they're just picking up and they just burst down and just break down crying. I've had many phone calls like that. Many.
So, what do? You wait them out? Do you console them?
Of course, luckily I'm a social worker, so I'm able to just console them and just talk to them a lot.
So, what do you say to them?
Just I just hear them out. Just listen to them, hear them out, ask them questions, try to like make them feel as good as I could. I mean, what are you going to do? There's nothing you could do or say, to like help them, and then we're not allowed to go on the actual floor. Nurses and doctors also, because all of these patients are in isolation rooms, so they're like pretty much locked in. It's like a cell, pretty much. So whenever it's time to give them medicine or this and that, a nurse will go in fully like clothed, and then they'll just go in really quick, hand them their meds, and they're right on out. The doctors will call them on their actual cell phones or whatnot, and they'll speak that way, because a lot of people are getting sick, so they're just pretty much locked in these rooms. And I think that the worst thing that I saw was when it first started kind of going around, and we were kind of learning what it was. The first woman that I ever saw, it was so sad. She was just pacing back and forth and back and forth and back, and she was just crying, and she was banging and banging and banging on the wall. I was like, I felt so bad, so bad. But I never went up there again. Never. I didn't even want to see that.
Do you talk to the nurses at all? Mm-hmm. How do you think they feel?
Well, I have personal relationships with the nurses, with the social workers, and everyone's scared. They're really scared. I have a couple of co-workers that they are social workers, but they also have nursing degrees, and now they're being pulled in to the floor. So they're scared, they can't go home to their kids, to their husbands, or anything like that. So they're like sleeping somewhere else. They're seeing their children through glass doors. They're like driving by and like waving. It's really sad.
Besides, if you didn't, you want to check that? Mm. If you didn't work in the hospital, mm-hmm. and you were, because you were social worker, mm-hmm. in a sense.
Yeah.
If you didn't work in the hospital, and a person was, like for instance, there was a guy, he was like, I read about it, I think he was like 34 years old. Mm-hmm. He committed suicide, mm-hmm. because he couldn't handle sitting in the house, not being able to go outside. It was too much for him. Mm-hmm. Depression.
Yeah.
Would you have anything to say to that guy had you been able to talk to him to cope? Or do you feel that you're outside of the range of being able to even,
Well, in my role now, even though my background is social work and counseling, and that's what I've done for like the past like 15 years, right now my role is just insurance, but obviously when I'm speaking to them and they're like sad, they're like, I spoke to one man and he's undocumented. He came from Guatemala like 2 years ago, and he just broke down crying. And I was like, why are you like so upset and this and that? Because when I looked, his son had pancreatitis. pancreatitis, I think it's called. And I was like, he doesn't have COVID or whatnot, this and that. And he was just telling me how guilty he felt because this is his 16-year-old son that he just paid someone to cross him from the border and like bring him over. And he said, wow, now I like exposed him to this. He would have been better over there with his mom, with his family, safe in his house. And now I'm here living in a room with 10 other men with my son, and he just broke down crying. So I spoke to him, and you just have to have a heart. I just listened to him, and all you could do is try to like console them, but it's not like therapy. It's not like a weekly session. It's not like if these people have any supports. These people have no supports. They're losing their jobs. Their cell phones are being disconnected. They live in a room, illegally with like 8 other men. They're gonna be out in the street in the next 30 days with their children. What do? They're scared. Trump is our president. They're frightened. They're like, where do we go? They don't know about resources. They don't speak our language. So
you want to check it? Go ahead, check it. Go.
Novelty sound bites. Oh shit.
Anonymous podcast.
Yeah, I smoked a lot.